Well, two get motivated us actually. First, clinicians often observe that allergy flares coincide with hoarseness or throat clearing or voice fatigue, but large population-based data have been scarce. So we wanted to look into that. And second, while this unified airway model is widely discussed, we lack a broad epidemiological evidence connecting allergic disease with voice outcomes especially. So we wanted to test that link and also explore whether women and men are affected differently. Well, firstly, our findings showed prevalence. About 1 in 4 participants reported diagnosed respiratory allergy. Nearly 1 in 5 reported 2 or more vocal symptoms weekly or daily in the past year. And then secondly, the association. So people with respiratory allergies were significantly more likely to respond to a higher symptom, report a higher symptom burden, 2 or more frequent vocal symptoms than non-allergic peers. And then we find some symptom profiles that allergic individuals more often reported hoarseness or low voice, strained or tired voice, and sensation of lump in the throat. And then finally, the gender differences, so that the allergy voice link was especially pronounced in women, where women with allergies carried the highest vocal symptom burden. Support for the unified airway is that our findings align with the idea that inflammation in one part of the airway can affect others. So people with upper airway allergies were more likely to have laryngeal or vocal complaints, suggesting shared mucosal responses along the airway. And the likely mechanisms behind these are mucosal inflammation and edema, for example. So allergic rhinitis can contribute to swelling and altered vibratory characteristics of the vocal folds, increasing phonatory effort and hoarseness. And then also postnasal drip and cough, where throat clearing can irritate the larynx and reinforce a cycle of tension and phonotrauma. Where most common overall was coughing or the need of clearing the throat while talking. That was the most frequently reported symptom in the whole sample, but stronger association with allergy compared to with non-allergic participants. So those with allergies were more prone to report hoarse or low voice, strained or tired voice, or vocal fatigue, and a sensation of of tension or lump in the throat. So then difficulty in being heard or voice breaks while talking were less clearly linked to allergy in our data. Women in general reported more frequent vocal symptoms, and among those with allergies, women had notably higher symptom burden than men. And possible explanations for this are the biological and laryngeal factors. Women's vocal folds are smaller and might be more vulnerable to edema and vibratory disruption from inflammation and dehydration. Also, cough sensitivity, so chronic cough and throat clearing behaviors are more prevalent in women, possibly amplifying this laryngeal irritation. And then finally, occupational voice use. So a higher proportion of women reported high voice use jobs, which can compound the effect of allergy-related irritation as well. So bottom line, that women with allergies may be at particular risk for clinically significant voice issues, and deserve proactive screening and counseling in that. More than men, or the risk might be higher than among men.